Have you noticed that you and your spouse don't always think alike, or feel alike, or act alike?
God's goal for marriage is oneness, not sameness.
Hello all, welcome back to our channel. How are you guys doing today? Thank you for tuning in. If you're new here, you are highly welcome. Please do not forget to subscribe, hit on the bell so you will not miss any of our content. Thank you so much. Today's video is the continuation of the lab week video. We're gonna learn about hematology department. Yeah, are you excited? And this is part of the lab week inspiration where I create an awareness for those of you that are not really familiar with all the department in the lab. We basically have 5 departments. So far, I've posted 3 departments. So if you've not watched those departments, I'm gonna try to put the link down below. This is the 4th department you're gonna be learning. Probably by the end of next week, I should be able to post the last, which is the 5th department. Without further ado, let's just go right into it.
Hey, my name's John. I work here at Piedmont Newton Laboratory. I've been working here for over 10 years, but I've been working in the laboratory for over 20 years. I work in hematology here in this lab, and in a nutshell, hematology is counting cells and identifying different cells. And we take that information and we relay that information to the doctor so he can determine diagnosis for patients. We start off usually with whole blood. We take a tube of blood, we run it through an analyzer. In the hematology department, we take a tube of blood and we break it down into the 3 main parts of the 3 main cells types in blood, which are the white blood cells, red blood cells, and platelets. And between those, we determine how big they are, how many you have, the different shapes and sizes, because everything can determine what kind of disorder you have. For an example, red blood cells, you have a low volume of red blood cells. That's what we call anemia, and we relay that information to the doctor to determine the appropriate action treatment. And it depends on what type of anemia you have. If you have an acute blood loss, then we usually just give you blood, which corrects that problem. But there are some patients that have long-term anemia where they use iron supplements and other medicines to bring that blood up. Something else we look at are white blood cells. White blood cells fight infections, and we break down those white blood cells even farther into neutrophils, lymphocytes, monocytes, and eos. In each class of those cells determine the underlying condition that you may have. For instance, we look at neutrophils. High number of neutrophils usually indicate some kind of bacterial infection. Lymphocytes usually indicate some kind of viral infection. So again, we just relay that information to the doctor, what we see, and then he determines the diagnosis. We also look at platelets. Patients that have low platelets, we can look under the microscope here. We make a slide, and this is where we look at the cells, the red blood cells, white blood cells, and platelets, and we determine what we see, and we relay that information to the doctor. And then the doctor determines the course of action. So we use the microscope a lot, and we have special stains that we stain our blood with, and the stain colors or maximizes the effects of different cells, and that helps us determine what kind of blood cells they are. Not only do we do blood, we also do different body fluids, synovial fluid, which is your joint fluid. We look at crystals in the joint fluid. Usually when you have fluid, it's usually caused by gout. You can actually see gout crystals in the fluid. We also look at CSF, spinal fluid. We determine what kind of cells, if there are any in spinal fluid. There should never be any cells in spinal fluid. But again, what we see is what we relay to the doctor, and he determines a diagnosis for that patient. So usually any kind of fluid known to man, we look at it, we analyze it, and then we send that information to the doctor. One other thing that we look at in hematology is urines. And this is our urine analyzer. And it's an automated system. And we take a tube of urine, put it on the analyzer. And the urine can tell you a lot about your health, whether you're diabetic, whether you have a urinary tract infection. We also can look for STDs in the urine. We can also look for ketones or some kind of ketoacidosis from diabetics, also from people that are starving or not getting the nutrition that they need. You can tell a lot about somebody according to their urine, which we have all this. This is the instrument that we use. And again, we also use the microscope a lot to actually visualize what we're seeing. Also, the other aspect of hematology is coag. And in coag, we use this machine, and coagulation is a very sensitive test. The tubes have to be perfectly filled. And in coag, we test the pathways of the intrinsic pathway and the extrinsic pathway of the body, which means how well does your blood clot, how well does your body dissolve that clot. We do PT, PTTs. PT, we determines Coumadin factor, how thin your blood is or how thick your blood is, from Coumadin, heparin, and we also do a test called fibrinogen to see how well your body produces clots and gets rid of clots. So that's what we do in coag. Thank you.